So you've been given this drill because you lack hip extension and we're experiencing a lot of restriction in the front of the hip and not a lot of control pulling us into deeper ranges of motion through a hip bend or allowing our hip and our glute to get behind our body this way. So what we'll need is a box or something to elevate our back leg so that it puts us into a front-sided leg / hip stretch, and something to hold on to stabilize our body. So I'll show this on my left leg. So I'll take this classic couch stretch position where I experience a stretch in the front of my hip towards the pocket or down through my quad. I can allow this to be on this side or this side, but for video purpose, I'm going to leave it on my right. And when we're improving range of motion, because it's stiff, it's restricted, we are going to stay in a position where we just feel a nice light stretch, where I can stay here for 2 minutes. And we really want to take advantage of the time in the stretch because that teaches our brain to start experiencing this new position that we are going to try to improve and then try to get us further into a new one as we do it. A couple things to keep in mind is we don't want to feel any pinching type pains or any back pain while we're doing this. So if that's happening, either the foot needs to go down or my body needs to really go more forward because in too deep of a stretch. So it's been 2 minutes, and what I need to do is start preparing myself to create contractions where I will be pushing down through the box here almost as if I'm straightening my leg out, and then I'll follow it with what's known as a rails contraction where all the shortened tissue on the backside, my glute, my hamstring, are going to get squeezed and tightened and allow me to try to attempt to lift off of this box. Cramping is common in this position. It is normal. As you start to get used to the drill, it will start to go away and your ranges of motion will improve. Try not to override these cramps by just running away. We are going to stay in it and utilize a softer contraction to overcome those cramping sensations. So now that it's been 2 minutes, I'm going to lightly stiffen my core. I'm going to slowly start pushing down through my foot back here to straighten my leg out. That contracts the front. I'm going to dial up how hard I'm trying. I'm going to get myself to about 50% effort. And if I'm doing pretty good and I want to ramp it up to about 75% effort, that's great. I'm going to keep breathing in this position. I'm going to hold that contraction once I get to 75% for 10 seconds. 8, 7, 6, 5, 4, 3, 2, 1. I'm braced nice and hard. My glute is getting squeezed and I'm bringing my heel towards my butt to get the back side of my leg working. I'm trying to use about 50% effort again and match what I was doing, holding that for 10 to 15 seconds. 4, 3, 2, 1. I'm going to get into a stretch and I can either lean back slightly but not through my spine to get taller to put me in a deeper stretch, or if I want to feel more in the front, I can lean forward. But I'm going to stay here for another 15 to 30 seconds, slowly relax, let my heart rate come back down, and then I'll repeat a push, which is going to occur in about 3 seconds here. Core is lightly engaged. I'm pushing. I'm stimulating the front stuff all through here, holding that, dialing it up to about 50 to 70% effort again. Once I get there, my timer starts. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Core is engaged again, and my glute and my hamstring are now turned on. I'm going to get shaky here. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And relax completely. Come out of it nice and slow. So having something underneath your knee when you're in this position is a very nice thing to do. So I would highly recommend putting a pillow underneath there or something nice and soft. Effort is important in order to maximize range of motion, and that's all controlled by you. So if you're only comfortable doing a 30 to 50% contraction on that dial, then we only do a 30 to 50% contraction at first, but it should get incrementally harder so that you are straining slightly, not painful, but straining to where it's work that you are doing, almost as if you are exercising and lifting weights. In order to gain range of motion, it takes effort. And one of those ways we gauge that is by the amount of pressure that you're using to engage soft tissues.